Hello, HIMSS 2022. Thank you everybody for joining us today for this Fireside chat. I'm here today with Michael Kopinsky from Way to Health. Hello, my name is Mohammed Shabli. I'm a VP of Solutions on our product team. And we're going to be talking about Mirth Connect and how Way to Health is using Mirth Connect to support a hospital in Philadelphia. So Michael, why don't you tell us a little bit about Way to Health and what you're doing today with Mirth Connect?
Sure, happy to be here. Thank you for inviting me. Way to Health is a clinical clinical research tool and patient engagement platform built at our health system in Philadelphia. It was built originally as a tool to run various patient engagement behavior modification type research studies. So it was originally you're using things like connected devices, internet-connected pill bottles to run large research studies along the lines of, if you take all your medication today, then tomorrow we'll enter you in a lottery to win $50. And really looking at how those tools would work, whether they're effective running large randomized controlled trials, using them, and as well as whether they're cost effective. Over time, we've shifted more and more into the clinical and like patient operations realm, where our focus tends to be less on behavior modification per se, and more on connecting, facilitating communication between patients and the health system. So we have studied programs like Heart Safe Motherhood, one of our foremost, really the first of our programs that converted from a study into a clinical program that's run as standard of care, where new mothers who are at risk for preeclampsia will text them twice a day saying, "Good morning, it's time to take your blood pressure." We give them, in the hospital, we give them a blood pressure cuff, and they text us back 120/70. We'll say back, "Okay, that's great. We'll check in with you this afternoon." And what that has enabled is that rather than detecting on day 7 that, oh, their blood pressure is running high when they come in for a clinic visit, or detecting on day 4 when they come in an ambulance with eclampsia, we can detect it early, that it's starting to rise, and to really detect that early. And in COVID, we have another large program that launched very quickly around March of 2020, COVID Watch, using a similar type of flow where we text patients twice a day. "Good morning, how are you feeling? Better, same, or worse than before?" They respond via SMS. And if they say they're feeling worse, we escalate to a nurse, and that lets us send home patients that were otherwise worried might deteriorate, because we're watching them. If they do deteriorate, we'll detect that early rather than putting them at risk. Yeah.
Nice. So it sounds like all of these projects have some mechanism for integration, data sharing, data access. And today I understand that you're using Mirth Connect to do a lot of that work. How does Mirth Connect as a product factor into all of those projects that you just described?
Sure. Mirth Connect, we really use it as a Swiss Army knife for all sorts of different data moving, data integration, workflow integration type flows, some of which are fairly standard. Like when one thinks Mirth Connect data integration, like HL7 feeds is one part of what we do, and we do have some programs that are powered by HL7 feeds. We receive a scheduling feed from the surgery module when patients are so we know when someone is scheduled for a colorectal surgery, and at a certain period before their surgery, we start messaging them with pre-surgical educational materials. And we also receive an ADT feed, so when patients are discharged after that surgery, we receive that information and can trigger them for the post-surgical component of that program. But we also use Mirth Connect in a lot of other ways as an ETL tool, loading data from one source to another. Sometimes there's a general purpose scripting engine. I have a task that I want to run every day at 9 a.m., set it up as a Mirth channel, to pull data from this API and just send it to the other API. It's really an invaluable tool for all sorts of different programs that we use.
That's awesome. And so from the development perspective, how do you and your team get feedback on the efficacy of this data exchange and this kind of flow? Do you have like messaging with providers? Are you hearing feedback from the end users, maybe the folks doing the research and the studies? Are they giving you feedback on how well these interfaces and these patient messaging solutions are working?
Yeah, so I think there's a lot of different feedback loops, some of which, like as a short feedback loop, we set up the integration, we see the next day, yes, patients are being enrolled, we have some monitoring to see how many patients per day are being enrolled in these different programs. And that's kind of like the short loop. Is our integration working? Is our development working? Kind of the next loop is, how is the program as a whole working? Are these patients getting the text messages that they should be getting? Are they getting their are they responding to the text messages? Do we need to reword the text messages so that to better solicit responses, get a higher response rate? And often the people looking at that level of at that level of the program may not even know what Mirth Connect is. They know that we're getting the data from the EHR, where they know that it's being based on scheduling data, but they may or may not know what HL7 is or what Mirth is. It's actually interesting how many of our customers do know what Mirth is. Like our implementation team will talk about Mirth, but that doesn't mean that the customers necessarily know the inner guts of what's going on the integration side.
Yeah, I agree completely. In fact, when it works, it should be invisible to the end users. They shouldn't know. There shouldn't be any hiccup. It should be like magic for them when the interface delivers the data that they want at that point of care. So what does it mean to you when you were looking at integration engines and you had a lot of choices out in the market? What was it about Mirth Connect specifically that made it a tool for you to use and you to implement?
Yeah, so we do also have an enterprise, a separate integration engine that is used within the health system. And the reason we set up Mirth is because it's easy to set up, easy to get going. The full Mirth instance is owned by my team. We don't need to work with anyone else. We don't need to purchase it from vendors. We have, over time, we have purchased the add-on bundles that are super valuable as we've scaled up, but we're able to get going with no direct dollar cost. That is certainly one major component. The community around Mirth Connect is a huge factor. I hang out constantly. There's a Slack group where I post a question, and within minutes, they get answers. Sometimes from NextGen employees who hang out there. Sometimes from community members. It's really a great place, and there's forums as well that I personally don't use as heavily, but many community people do get a lot of value from.
Yeah, that's awesome. I think that's one of the key differentiators we have as an open source product, that we have built this entire community of people around the world who are really using Mirth Connect to build cool integrations. So, but just by way of wrapping up, what's next for Way to Health? What are you working on next? What are some of the cool integrations you want to build out in the future?
Sure. So right now, actually, perhaps as I speak, one of the developers on our team in Philadelphia is working on new integrations. This is our first HL7 feed sending data back to the EHR. We send data through other mechanisms, through web services, through other approaches. But this is going to be our first HL7 feed sending images back into the chart, generally, we're about to kick off a 6-week cycle focusing on some of our messaging, like the core messaging at the heart of some of our patient communications, kind of really shoring those up, use some of it using a natural language understanding. So instead of having to respond A, better, B, same, C, worse, they can respond, yeah, I'm feeling a bit better today. And the NLU, the AI, can be smart enough to know that that corresponds to A, better. So really working on those messaging pieces, and there's always new programs trying to launch. our Trello board has dozens of projects in the launch phase, in the testing phase. So always more projects that I can't even keep up with.
Well, that's awesome. Thank you so much, Michael, for sharing with us and for talking a little bit about Way to Health and how Mirth Connect is supporting your organization. So thanks so much for being here.